Good afternoon, everybody. I hope you can see my screen.
Chris, you are on mute.
We can hear you, Chris, and we can see your screen.
But I am not hearing. Sorry.
Okay, thank you, Alex. It's a great pleasure to be able to present along with Mr. Séraphin and Dr. Oumar from our team in Cote d'Ivoire. And we've focused this not on the whole of the HPV vaccination introduction, but really on the COVID impact. Before I hand over, I'll just introduce, it's wonderful, I have to say, that we're starting off this important meeting with West Africa. Very nice to be in this location. Gavi, along with other partners like WHO, supported introductions from November 2019 in Cote d'Ivoire and Liberia simultaneously. In both countries, it was a single age cohort introduction aiming at the 9-year-old girl based on the likelihood of reaching them through school-based delivery. And are both routinized, so to speak, as in the vaccine is provided on a monthly basis, particularly through schools was the plan, that with schools anchored to health facilities, so seen as outreach sites from particular health facilities, supplemented where needed by community outreach to access out-of-school girls. As I said, there were multiple partners and we're very grateful for the Gavi support to the systems, the technical assistance, and of course the vaccines. This was the plan, but then from March 2020, we had the COVID pandemic and all of its impacts. So I'm going to hand over to my colleagues, Mr. Séraphin and Dr. Oumar, to talk about the COVID impacts, particularly in Cote d'Ivoire, although they were similar in both countries. And then I'll come back to Liberia and conclusions at the end. Séraphin and Dr. Oumar, over to you.
Okay. Hi, everyone. It's an honor for me to present on behalf of the Jhpiego team in Cote d'Ivoire. Before talking about COVID-19 impacts, we completed first dose coverage program and supervision in January, February. Then first COVID-19 case occurred in March 2020. So outbreaks caused school closures and other travel restrictions, loss of confidence in facilities, rumors and misinformation that targeted HPV, including sterility, misinformation. Sometimes conflated HPV vaccine with COVID-19 vaccine. Also, vaccine-derived poliovirus outbreaks that require the deployment of novel monovalent oral poliovirus tube. Next slide, please. As we have just seen, outbreaks have resulted in the non-achievement of coverage targets at year end. In fact, coverage of first dose was 44% and 9% for the second dose. Relatively to second dose, it started 6 months after introduction, I mean in May 2020. Due to weak coverage, many efforts are needed to catch up girls so as to complete the vaccination. Next slide, please. Furthermore, we observe on this graph a drastic drop in coverage of HPV first dose comparatively to pentavalent vaccine third dose. So HPV vaccination was effective more than infect vaccines in Cote d'Ivoire. Next slide, please. In order to respond to a pandemic in Cote d'Ivoire, several interventions are done, such as communication, from the API director to continue with all routine immunization, periodic intensification of vaccination against HPV in 15 health districts with high population and which had suffered restriction on movements. Organization of sensitization meetings for vaccinators, community and religious leaders, and teaching staff. Coordination of activities with teaching staff, which was consisted on planning vaccination response to hesitancy. Also, community-based catch-up for girls not in school was 15%, and school was 14%. Next slide, please. Considering that many girls missed vaccination in 2020 and are needed to catch up this year, good planning needed to follow up those newly eligible and systematically provide catch-up for unvaccinated girls in 2021. Continue periodic intensification of immunization activities to complement the continued routine service. Thank everyone. Chris, for a nice time. Next slide, please.
Thank you, Séraphin. That was very clear. Liberia, we just actually had a similar dip in coverage and a similar effect where the impact on HPV was worse than on pentavalent. Liberia also, in a different way, had a periodic intensification of routine immunization for many antigens, but late in the year, they included HPV alongside other infant vaccines. And you can see around September, October, there was some response in the monthly HPV vaccination coverage as part of that periodic intensification. And particularly in the green, that they were able to mobilize community outreach as part of that response. So we'll finish with some overall lessons. Like everywhere in the world, the planning and coordination had to shift online or telephone. And I think, like all of us has found, it doesn't work very well. It is actually very tough to do meetings like this one we're in now. It's very tough to do it when the internet is poor. The effect of the pandemic has shown up particularly for places where the HPV vaccine is given month by month on a routine basis. We actually need new systems to track those girls who were eligible last year and missed out on vaccination. We need new systems to track them so that they can receive their catch-up vaccination this year. One new thing that Séraphin described is this periodic intensification of routine immunization. This has been a staple of infant vaccines for more than a decade. But what has been shown, particularly in Cote d'Ivoire, is that you can do a PIRI that is very focused on school-based campaigns. So we have something halfway between a full campaign and routine services. And the fact that this worked as catch-up in Cote d'Ivoire has given them a tool that they will continue to use alongside their routine service into the future. And one comment about communications. Both countries had to pivot in the middle of last year to communications that added messages to encourage families to bring their girls or the girls themselves to come to health facilities rather than wait for the vaccinations to reach a school, which was often closed. That was a new type of messaging, and in both places, very specific messages to counter the dreadful misinformation was also needed. So I'll finish there and hand it back to the chair, Samesh. Thank you very much for the opportunity to present.